Surgical Preparation Lecture. Preparation of the room is done first. Review the procedure and note materials needed. Oftentimes medical assistants will have a notebook or a notepad that has specifics in what the physician wants for a specific procedure that is going to be done. This way you can ensure that you have all the supplies needed and gathered for the procedure before it starts. Prepare the room and gather your supplies. Open sterile supplies just before the procedure and cover the sterile field with a sterile drape. Be sure not to reach over the sterile field or it would be considered not sterile. Sterile technique includes sterile surfaces that must never come in contact with non-sterile surfaces. Constant vigilance and absolute honesty are essential for maintaining sterile technique. If this occurs, it is a break and everything must stop until sterility must be achieved again. This typically involves tearing down the whole entire sterile field and starting over. It is important to learn and practice all the skills of surgical asepsis so we do not compromise the outcomes of the patient. The sterile field, in this picture you will see the red tape. Anything outside of the red tape is considered non-sterile. So on a mayo tray, the 1-inch outer border is considered not sterile. If the sterile field gets wet, either by a splash or missing pouring a solution, this would be considered non-sterile, and the sterile field would have to be restarted. Never turn your back on a sterile field, and hands should always remain above the waist and in front of you, as you can see this person is doing. Do not talk or cough or sneeze over the sterile field, as this will contaminate your field. Do not ever reach over your sterile field, as this can contaminate the instruments on the field. Assisting the physician during the surgery. You are responsible for ensuring that everything the assistant and the physician will use in caring for the surgical patient is accounted for, ready for use, and prepared in a sterile manner. Establish a routine sequence and follow it each time. Sort and place instruments, place scalpels and sharp objects conspicuously. Hand the physician drapes one at a time and place it over the surgical site. Sometimes we will use a fenestrated drape, which has a hole in the middle of it that exposes the area in which the procedure will be done. However, sometimes the area is larger than what the fenestration may be, so we will place one towel on each side of the area. Passing instruments. It is important to pass instruments correctly during the surgical procedure to protect the sterile field and report any breaks to the patient. Dispose of soiled sponges into the biohazard waste container and anticipate the surgeon's need for instruments. The physician may request instruments and may use hand signals. So as you can see, it is important to hand the instruments. The sharpest point of the object should be in your hand and off to the side, and you should hand the handles to the physician to grab onto. You never want to place the sharpest object toward the physician's hand. Completing the procedure. As the procedure ends, the physician will begin the wound closure. Place the handle in a needle holder and pass it with the handle first. You may assist by cutting suture and sponging the site and helping to control bleeding. The steps after skin closure. The wound site is cleansed with wet using sterile normal saline solution and a sterile dry sponge by the surgeon or the medical assistant. A sterile dressing is placed over the incision and the bandage is applied to support the dressing. Some of your postoperative responsibilities will be if there is a specimen from a biopsy or a removal of a cyst, you will want to send that material to the lab to be analyzed, even though there may be no suspicion of cancer. We still send it to the lab to be analyzed. After caring for the patient, clear the sterile field and follow standard precautions. You should always be wearing disposable gloves until all contaminated material is removed. Place the disposable equipment in biohazard containers or sharp containers. A lot of times our surgical instruments should be placed in a puncture-proof container to ensure safety. Check the room for any blood spills or other contaminations and disinfect as appropriately needed. Remove gloves and sanitize your hands. This should be done by washing the hands, not just using a simple alcohol rub. Document in the patient's medical record what was done. Postoperative care instructions. Give the patient time to rest and recover from any sedatives that were given. Sometimes we give light sedatives such as Versed or an alprazolam to help the patient relax. Check with the physician if pain medications are required and obtain the proper prescriptions to send along with the patient. Review postoperative instructions with the patient and schedule follow-up visits. And give all instructions in writing. This is particularly important as sometimes patients are under sedatives and might not quite remember what you all said. Warning signs. It is important to explain to patients the warning signs of infection, so redness, heat, swelling, and pain. If the patient has any of these signs, they should be told to call the office right away. If they have any questions or concerns, they should be given a number in which they can call. All patients should be followed up within 24 hours after the surgery by phone call to ensure everything is going okay. Never allow the patient to leave without the physician's approval. Wounds should be kept dry and clean. It is important to instruct patients to keep this. Removing tape or dressings. If tape is holding a dressing in place, always remove it by pulling towards the wound. If it is adhering to a hairy area of the body, lift the outer tape edge with one hand and slowly gently separate the underlying hair and the skin from the tape with the thumb of your other hand. Peel the skin from the bandage, not the bandage from the skin. Never rapidly rip tape from the body because it may injure the skin that is healing. If the tape is not irritating to the patient, it may be advisable to leave the tape in place until total healing has taken place. There are several types of different wounds. As you can see here, wound healing, there is 4 different phases. There is the leg phase, which the blood vessels contract to control hemorrhage and blood platelets form a plug. Fibrin is released into the wound and begins the clotting, and the white blood cells clear away any type of bacteria that may be there. Proliferation occurs from days 5 to 20 and tissue repairs themselves. If even edges are there, complete contraction may occur, and a cicatrix or early scar tissue may develop. This is indicated by a pale, contracted form of skin. Remodeling phase is from day 21 onward, where collagen helps close the gaps of the wound. Scar tissue is not true skin. It is very strong but lacks elasticity, and it also lacks blood supply and nerve endings. Classifying wounds by repair method. So clean surgical wounds that have been sutured, closed, and heals quickly without scarring does so by first intention. Second intention or granulation heals occurs from bottom of the wound outward. So from the inside out, you will often hear. These are oftentimes called open wounds. Removal of debris from a wound is sometimes needed. This is called debridement. The advantages of an open wound healing is air can circulate freely around the wound is not irritated or rubbed by a dressing, the wound stays dry, which inhibits bacterial growth, reducing the chance of infection. Sutures stay dry and hold together better. Any pre-existing infections remain localized and will not spread by dressing or bandage. Dressings are a sterile covering placed over a wound for protecting the wound from injury and contamination. Maintaining constant pressure to minimize bleeding and swelling, they hold the wound edges together and absorb drainage and secretions. And as you can see here, we are placing a dressing over the patient's stitches to ensure sterility and prevent any kind of infection that could happen. Steri-Strips are used on a wound and often replace sutures. They provide support and hold edges of wounds together. They reduce infection and do not leave suture scars. Oftentimes we use Steri-Strips on places such as the face to minimize scarring. And sometimes physicians will choose not to use Steri-Strips, but they will choose to use what's called Dermabond, which is oftentimes used in the clinic. There has to be a straight edge of the wound. It cannot be a jagged edged wound. And what this Dermabond is it's a glue type material that is used to hold the wound edges together. Here's a picture of several different types of bandages. The question may be, what is the difference between a bandage and a dressing? A bandage is non-sterile and used to keep the covering underneath in place. It is also used to provide padding and protection to the wound. A dressing is a sterile application and it is applied directly to a wound. It is important to avoid contamination to prevent infection, and you need to make sure that the dressing has adequate absorption. So here's a picture of bandaging a hand, and we typically use the figure 8 method when doing joints. So for the hand, you will start around the wrist 2 times, and then you will loop in between the thumb and the pointer finger. You will do this a couple times and then you will switch back and loop around the wrist again to maximize the stabilization and support. Here's an example of how you would bandage and ankle. So you would wrap the bandage around the base of the foot a few times and then start in a figure 8 motion around the ankle. You will then do the figure 8 motion a few times and then end by wrapping the bandage around the foot one more time and placing a metal secure tab. Patient education. It's important to instruct patients on aseptic technique to use at home. It's important to explain to the patient that hands should be washed before meals, after sneezing, coughing, blowing nose, after using the bathroom, before and after changing a dressage or a bandage, and after changing an infant's diaper. Also instruct the patient about the differences between sterile and clean dressing and bandages, and also educate the patient on the signs of infection, redness, heat, swelling, and pain, and to report any or all of these right away to the physician. Call the patient before the surgery and explain everything thoroughly. So you want to make sure you give appropriate instructions after the procedure, but before the procedure is equally as important. Some procedures may require fasting or a prep of a certain shampoo that the patient may need to use. Legal and ethical issues. Personal discipline is the primary concern in surgical asepsis. If alone, when contamination occurs, it is still your responsibility to start over with sterile supplies. Become familiar with the various techniques of sanitization, disinfection, and sterilization. Confirm that the physician has explained the procedure to the patient and that the patient fully understands all aspects of the procedure to be performed.